رائدة الأعمال التالية تحدت المألوف بمنتج صحي قد يقلل الكثير من جلسات العلاج عند مرضى السرطان.
Hi Sharks, my name is Khadija Ali. It's a pleasure to be here, and today I'm going to share with you a revolutionary treatment for cancer. I want you to imagine someone that's been diagnosed with cancer. They get IV chemotherapy, and they're basically tied to a machine for several hours on end, and they have to do this several times during the week. Within a couple of hours, they end up with nausea and vomiting. Within a couple of days, they end up with hair loss and weight loss. And within a couple of weeks, they end up with long-term complications like kidney problems, liver problems, basically a whole plethora of other diseases on top of the cancer that they already have. This is something that I experienced firsthand with my dad about 12 years ago, which is where BioSapien came into being. And as a physician, I've seen this countless times with multiple patients as well. And the reality is that 1 in 3 of us here and in the world will actually be diagnosed with cancer. So what are we going to do about it? Well, my amazing team of ex-FDA, pharma, clinicians, academia, basically all of the excellent minds in the industry came together to help us bring this product to where it is today. We also have a Nobel nominee, as well as insurance providers and hospital providers that are supporting us on this mission. And what we've created is essentially MediChip. The idea is that it's a 3D printed drug delivery platform. Simply put, it's a Band-Aid for your cancer. So for example, if you have a cancer inside your stomach, instead of cutting it out and having to eat through a tube or blasting your entire body and impacting all the healthy stuff, you take this Band-Aid that you see there, take the 4 corners and attach it directly onto the tumor. When you attach it directly onto the tumor while you're sitting, eating, driving, sleeping, the cancer is getting treated locally. The beautiful thing is that we've actually tested this in animals. So we've tested this in mice, in rats, and it has shown that it actually is safer than IV chemotherapy and has better efficacy, meaning that it kills the tumor much faster and much better than IV chemotherapy as a whole. And the technology itself is really simple. If you've ever had a cut, a suture, basically you get a cut and they suture it up. We basically take that suture and we take drugs that already exist on the market. We combine them together to create this MediChip. And as a result, we are now ready to start clinical trials in Abu Dhabi. So we are starting with partnerships with Cleveland, Bourjil, Tuam, and SSMC. And essentially, we've managed to do this all with $3 million to date. And the reason why that is because our company is super lean and all our team members are really believe in our mission and are paid through equity, which is really exciting for us. I just want to highlight, we just graduated from Hub 71 in Abu Dhabi just a few months back, and we're grateful for all their support. We are now looking to raise $5 million to start clinical trials. And what that means is we'll be testing in patients that actually have cancer and need this treatment dearly. We have $3.5 million of that already confirmed and committed. And we are looking to raise the rest. The beautiful thing about our technology is that unlike traditional biotech companies, we don't have to do phase 1, phase 2, phase 3, or take 10 years and $2 billion to get to market. So remember how I said that it's materials we already use? Because of that, we are on an accelerated pathway with 505(b)(2). And what that really means is that with one clinical trial, we can get to patients quicker. So by 2026, we will actually be able to sell this in the market in UAE and 2027 within the US. If there are any delays, well, we can bypass that by actually using this in animals such as horses, camels, cats, and dogs. And the other benefit is that on our team, we have 4 ex-FDA members, including the ex-director of the FDA, helping and guiding us to ensure that we can get to market. The last thing I also just want to mention here is that the way we make this is we 3D print. So what that means is that there's not a lot of human capital that's needed or operations that are needed in order to produce our products. So our cost of goods are extremely low. When you get IV chemotherapy, you're looking at $150,000 up to $1 million depending on side effects. We price our chip at a fraction of that at $10,000. And we make this chip for under $100. So today I'm offering you an opportunity to join our mission. So the ask itself is 1.85 million dirhams for 2% of the company. Sharks, now I invite you to join our mission in treating 1 million patients by 2035. Yalla.
Thank you, Khatija, and welcome to the show. Just explain to me quickly.
You said it's like a Band-Aid. So this goes on top of the skin, or do you have to insert this and then restitch the person? That's a great question. So actually, you can do this through minimally invasive techniques. So we can do what's called an outpatient procedure. So it takes about 20 minutes for us to do. You fall asleep for 15 minutes and we plug it in and you wake up and you do this once a month. So the chip can go inside or outside depending on where the tumors are? Correct. Ideally, we want it directly on top of the tumor because the purpose is that it's very local. How big is it? So I'm glad you asked that. I actually have one with me. So it's about the size of a quarter, and you can actually see inside of it, the white opaque part is the active drug in itself. The four corners that we have there are the sutures to be able to place the sutures. It's on the other side. So it's like a quarter of this bag almost? Yes, yep. Perfect. Great, and this would either go on top of the skin or inside as close as possible to the tumor? Ideally inside, because if you put it on top, then you have to do bypass and like things like that, so it's not as effective. Great, thank you. Of course.
Oh, it's really cool. Tell me about your recent round. When was the recent round and at what valuation?
So we just closed a bridge round in December of last year with notable angels from the region. And that was at a $15 million valuation.
Dollars. When was that? 7
6
months
months ago.
And now you're asking for 25 million.
That's correct.
Why?
So multiple things. One, in the last 6 months, we have gotten several patents, including Europe, UK, India, which is huge markets that we can tap into. Second, we've actually launched an animal indication element to it, which allows us to go into horses, camels, in the MENA region, and cats and dogs in the US, which taps about a $300 billion market. And then we also have a cattle and commercial element to it, which is about a $1 trillion market.
And the 5 million you're raising now is going to be sufficient until when?
So that gives us a runway of multiple folds. So from a milestone perspective, it gives us a runway of 12 months from milestones. It gives us an operational runway of 24 months. And what I mean by milestone is that by the end of the 5 million, we will have data from 12 patients that have actually used this treatment. So we can then start doing what's called licensing deals to other pharma companies for other indications. And the valuation most likely jumps for biotech companies that have that type of human data, anywhere between 200 to 500 million, depending on the data itself.
Khadija, thank you for telling us about this unique company, and thank you for choosing the UAE to be your base.
Of course.
I'm excited to know about that part of your journey. I mean, why did you choose the UAE as opposed to, for example, doing it in the US or somewhere else?
I'm really glad you asked that, actually. So there's 3 reasons. One is the UAE in itself is a growing country. It has a lot of opportunities. And as a result, there's a lot of growth and need for innovation and desire to push that forward. The second is that there's actually a fast track opportunity available here that allows us to get this to patients much faster than in the US. Third thing is I was actually born in Saudi. So my dad used to speak a lot of Arabic growing up, and I was always curious about the region. So if anything, thank you for the opportunity.
Did you patent your innovation?
Yes, sir. It's patented worldwide until 2039.
I just have a question mark regarding how do you ensure the safety and the efficacy of the treatment long term?
That's a great question. So the way we ensure the safety and efficacy of the treatment long term is through the data that we've already done previously in the studies. And then the other thing is not to devalue the company that I've created, but we're not creating anything new in that sense, right? So we're not making a new drug. We're just finding a new way to deliver it.
How many people are you as part of the team?
So we are 8 people full-time, and then we have 4 part-time consultants, and then we're surrounded by a team of 50 advisors.
Khadija, I think that you are very impressive.
Thank you. That means a lot coming from you.
That you are incredibly impressive, and you should be very proud, and I'm sure that your father is very proud.
Don't make me cry on TV.
I would love to be part of your journey, but I would be looking to come in at terms of your bridge round. So the offer would be $500,000, which is 1.8 million dirhams, at a valuation of $15 million, which was the valuation of your bridge round previously. Is that something that you would be open to?
قبل الفاصل عرضت خديجة حصة من ميدتشيب أمام الشاركس ال5 بقيمة 1.85 مليون درهم مقابل 2% من شركتها.
I would love to be part of your journey, So the offer would be $500,000, which is 1.8 million dirhams, at a valuation of $15 million, which was the valuation of your bridge round previously. Is that something that you would be open to? Okay.
Okay, I have an offer for you. I can give you the 1.8 million, but for 3% instead.
Okay.
I applaud you for your commitment to this cause, and being again a UAE company makes us all proud. For that, I'm happy to also commit the 1.8 million dirhams at the same terms that Amira offered you, which is the extension of the past round.
I would love to go in with him.
Is this an offer?
This is an offer.
So effectively, you have two offers now.
You have 1.8 million dirhams from Tawfiq for 3% of the company. And then you have 3.6 million dirhams from Amira and Faisal combined for 6% of the company.
I think with three sharks, I think I'll let them play and compete among themselves. All the best. Good luck.
Thank you. Elise passed, and I'm going to give you my offer. My offer is 7.2 million dirhams, but I want 10% of the company.
Can I go talk to my investor in the back and I'll be right back?
Sure.
Absolutely.
You're also welcome to counter offer whoever you like.
Yes.
Okay, good to know. I'll be right back.
And so basically, their offer is better than yours?
No, that offer
hers
is
No,
is
my
better.
offer is better.
Wow, Noor, right? She's already very close, right? She's already at
Yeah.
10%.
Yeah.
We are already going to offer 8% for 2 million, proportion to what we're doing.
So maybe get
So
her
the
down
difference,
to
just meet in the middle.
Okay. Okay.
Yeah?
Yeah.
Go get it.
Thank you for waiting, Sharks. I really appreciate it. I would just like to say thank you for the offers. This means the world to me because it just validates what I've built in the last couple of years and all the white hair. So thank you so much. I would like to offer a counter, and my counter is to Noor. Noor, instead of the offer of $2 million at 10%, I would ask that you offer that for 9%.
Why is that important to you?
Because then I feel like I walked away winning.
So if I said 9.5%, would that be fine with you?
That would be fine with me. We could do a deal at 9.5%.
9.5% of it.
Congratulations.
Thank you so much.
Thank you. Then it's a deal.
Then
Thank
it's a
you so
deal.
much. It's understanding.
Thank you so much, guys.
Thank you.
My experience on Shark Tank is like diving in the ocean with sharks.
Congrats.
We got a deal for 2
Super well
million.
done. We came for 500K, we
Right?
got 2 million.
Times 4. I think after pitching to the Sharks and having 4 different offers, I am in like a state of disbelief. I can definitely see the business in the future growing with Noor, utilizing her expertise, and having her on board will allow us to understand not only UAE, but also other markets as well that she is well versed in.
I think it's a great company.
Yes, me too.
عن جد بحس إنه it works.
If it works,
It works really well.
مبروك.
الله يبارك فيك.